Hi, my name is Bernard. I'm a student nurse practitioner, and today we're going to be assessing your head, neck, and chest. All right, I've already washed my hands. Can you verify your name and date of birth?
Angela Wong, August 8th, 1983.
All right, perfect. So first we are inspecting the head. Head is normocephalic, atraumatic, symmetric. Face is also symmetric. No lesions or rashes noted. I'm going to inspect your scalp. All right, scalp, no lesions noted. I'm going to palpate now. Do you feel any tenderness?
No.
All right, no tenderness or masses noted. So hair is fine and evenly distributed. I'm going to palpate temporal arteries. Do you feel any tenderness? Okay, and pulses are 2+ bilaterally in strength. We're going to assess the eyes now. All right, first we're going to do a vision test. Can you hold this at arm's length? Do you wear any glasses?
Contacts.
Okay, and can you read the last line?
LTFPH,
Okay, can you cover the other eye and read it backwards?
HPFTL.
All right, perfect. Vision is 20/20 bilaterally. So we're inspecting. Eyebrows are symmetric, no lesions or rashes. Eyelids are symmetric, no lesions, rashes, or edema. Position of eyes are symmetric. Looking at the medial and lateral canthus, they are symmetric, no lesions or redness. Width of the palpable fissures are also symmetric. Assessing the lacrimal system, do you feel any tenderness?
No.
No tenderness in the lacrimal gland. Lacrimal sac, no obstruction or drainage noted. So now I'm going to pull down. Can you look up and down, side to side? All right, I'm gonna pull up. Palpebra and pupillar conjunctiva are pink bilaterally. Sclera is white bilaterally, no redness or jaundice noted. Corneas, no opacities, irises are well defined. Now we're gonna check the pupils. I'm going to flash a light into your eye. Pupils are equal, round, and reactive to light bilaterally, and they're about 3 centimeters in size. All right, so now we're going to do a direct and consensual pupillary light reflex test. I'm going to shine a light into your eye. Just look straight ahead for me. Okay, right eye constricts, so there is a direct reaction. I'm going to shine a light into that same eye. Just look straight ahead. Left eye constricted, so there is consensual reaction. So now we are going to test accommodation and convergence. You're just going to look straight ahead for me, and then when I put up my pen, I just want you to take a look at the pen. So look straight ahead. Pupils are dilated. Look at my pen. Pupils have restricted and converged, so normal accommodation and converges. We're going to test visual fields by confrontation. Can you cover one eye? Tell me how many fingers I'm holding up.
1, 2,
All right, cover the other eye.
2, 1.
All right, perfect. So normal confrontation test, and now we're going to test for extraocular movements. You're going to keep your head still. Just follow my pen with your eyes only. Okay, extraocular movements intact, no nystagmus noted. Now we're going to take a look at the back of the eye. I'm going to close the light. Okay, so I am going to, standing about 15 inches in front of patient, so I'm going to shine this light into your eye. Just look straight ahead for me. I am assessing patient's left eye, so I'm looking with my left eye. Okay, red reflexes noted. No lesions or opacities. All right, now moving in. All right, optic disc is visualized, orange in color. Retinal vessels are visualized, no AV nicking, no macular lesions. Disc ratio 0.3 centimeters, okay? Okay, so now we are going to assess the nose. I'm going to hold down one nostril. You're gonna breathe in and out with the other, okay? Okay, normal patency in both nostrils. Now I'm going to hold on one nostril, and you're going to breathe in. Tell me what you smell. Okay. Okay. All right, smell, ability to smell is normal in both ears. Sorry, in both nostrils. Now we're going to palpate the nose. Do you feel any tenderness? All right, so now we're going to take a look inside of the nose. We are going to tip the tip of the nose upward and look in. All right, nasal mucosa is pink, moist, no discharge, no nasal polyps. Septum is midline, okay? All right, so now we're going to assess the sinuses. Do you feel any tenderness? All right, no tenderness in frontal sinuses, maxillary sinuses. Do you feel any tenderness? All right, no tenderness. So now inspection of the lips. Lips are pink, moist, no swelling, cracks, or lesions. Can you open your mouth for me? All right, dentition is normal. I'm gonna take a look at your gums. All right, gums are pink, moist, no swelling, ulcers, or lesions noted. Now can you open your mouth for me? All right, buccal mucosa is pink, moist, no swelling or lesions. The other side, buccal mucosa is pink, moist, no swelling or lesions. Can you stick out your tongue for me? Tongue is symmetric, no lesions, or masses or rashes noted, no swelling. Can you lift up your tongue? Under the tongue is pink, no lesions or ulcers noted. Can you open your mouth? Soft and hard palates are pink, no lesions or ulcers noted. Can you stick out your tongue and say ah? Ah. All right, tonsils are absent bilaterally. All right, so now we are going to assess the ears. We're gonna do a hearing test first. I'm gonna stand behind you. Can you cover one ear and tell me what you hear?
1, 2, 3.
All right, cover the other ear.
ABC.
All right, perfect. Hearing is intact bilaterally. Now we are doing a Weber test. I'm gonna put this on top of your head. Tell me where you hear the sound, one or both ears. Both. All right, so sound lateralized to both ears, so normal Weber test. I'm going to put this on behind your ear. Tell me when you hear the sound stop. Okay, and now tell me when you hear it stop again.
Okay.
All right, so air conduction is greater than bone conduction, so normal line test. We're inspecting the ears. Auricles are symmetric, no lesions noted. We're gonna palpate the mastoid process. Do you feel any lesion? Any tenderness?
No.
Okay, palpate the tragus. Any tenderness? All right, so we're gonna look inside of the ear. We're gonna pull the ear, the auricle up and back, and we're looking in. Ear canal is visualized, no cerumen, no redness, drainage, no masses or lesions. Tympanic membrane is pearly gray. Cone of light is in the 5 o'clock position. No scar, no perforation in the tympanic membrane. Handle of malleus and pars flaccida is visualized. Now the other ear, we are pulling the auricle up and back. No cerumen, redness, drainage or lesions in the ear canal. Tympanic membrane is pearly gray, no scarring, no perforation. Cone of light is seen at the 7 o'clock position. Pars flaccida and handle of malleus are visualized. Okay. All right. So now we are going to assess the neck. Can you raise your neck? Perfect. So neck is symmetric. There are no masses seen. And pulsation is symmetric. All right, so I'm going to palpate the lymph nodes. Tell me if you feel anything. All right, so pre-auricle, post-auricle, occipital, tonsillar, submandibular, submental, superior cervical chain, posterior cervical chain, deep cervical chain, supraclavicular. All right, any tenderness anywhere?
No.
All right, perfect. Can you lift your neck up? We are palpating with one finger, trachea's midline, no masses noted. All right, we're going to assess the thyroid gland. This is the cricoid gland here. Can you lift your neck up? So thyroid gland is here. The thyroid isthmus is normal, no nodules or masses noted. Do you feel any tenderness? Okay, perfect. So now we are going to assess the chest. All right, so first I'm just going to inspect. So chest is symmetric, no rashes or lesions noted. Respiratory and rate and rhythm of respiratory of breathing is normal. Can you breathe in and out? Chest expansion is symmetric. This is lateral AP, so AP to lateral diameter is 1 to 2. So now we're going to palpate. Do you feel any tenderness anywhere? No. All right, no tenderness or masses noted. Now we're going to percuss. Okay, all sounds are resonant. Now we're going to auscultate. Okay. All right, breathe in and out. All right, in and out, in and out, in and out, in and out, in and out. Breathe in and out. 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 All right, lungs are clear bilaterally. So now can you swing over this way for me? All right, so now we're going to palpate the back. Do you feel any tenderness? Okay, no tenderness or mass is noted. Can you take a breath in? All right, chest expansion is symmetric. Now we're going to percuss. Okay, all sounds are resonant. Now we're going to find the diaphragmatic excursion. Well, actually, first you're going to take a breath in, and then take a breathe out, and then hold on expiration. All right, this is where we have area of dullness. So you're going to breathe in and out again, and then you're going to breathe in and hold the inspiration. Okay, so the areas between the two areas of dullness of 4 centimeters, which is normal. Okay, so now we are going to auscultate. Breathe in and out. Okay, lungs are clear bilaterally, so now we're gonna check for tactile fermentus. Every time I say 99, every time you feel my hand, say 99.
99.
Okay, this is normal, sound is muffled. Now we are going, which means no consolidation. Now we are going to check for the whisper pectoriloquy test. Every time you feel my stethoscope, say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, normal sound is faint and muffled. Now we are going to do the gophony. Say E. Okay, E is heard, not ah, which means no consolidation. And this concludes the exam.